Hi everyone, my name is Elise Allen and I'm a counseling student at Cornerstone University. I've also been volunteering with Royal Family Kids Camp for over 5 years. And as a fun fact, I started volunteering as a balloon artist, so giving this presentation is a little bit of a different role for me. However, I'm excited to be working with each and every single one of you at our upcoming Royal Family Kids Camp. As you know, each and every single one of our campers has been or is currently in the foster care system. And so my goal today is to give a presentation on a royally complex problem, understanding complex trauma in Royal Family Kids campers. As you will soon learn, our campers thrive when they have a clear plan for the day. And so my goal is to give a similar roadmap of the presentation. By the end of this presentation, all of you volunteers should be able to distinguish between trauma and complex trauma, list 3 symptoms of complex trauma, describe 3 ways that complex trauma impacts development, and lastly, apply 2 trauma-informed techniques in role plays. So let's start with some statistics. The Wisconsin Department of Children and Families in 2023 received 33,051 different maltreatment reports, of which 4,000 were verified. This represents 3,608 different child victims, and of those kids, 2,168 were removed from their homes within 60 days of the report due to concerns about their safety. Now, these reports were made for a number of different reasons, and the number one most frequent reason was neglect, followed by physical abuse, then sexual abuse, and then emotional damage or abuse. And these all represent different sources of trauma in these kids' lives. However, aside from these, there are also additional traumas that kids could have potentially encountered while they were in their homes, such as exposure to mental illness, drug abuse, crime, and violence. Furthermore, although the foster care system intends to help, it can contribute to more trauma through things like removal from homes and placement changes, which can be stressful for these kids. Now, the things I talked about in the past slide are all examples of trauma, but there is actually a difference between trauma and complex trauma. Now, trauma, as it's defined by the Diagnostic and Statistics Manual, which is the book of diagnoses for mental health professionals, is defined as typically one event, which represents actual or threatened death, serious injury, or sexual violence. Furthermore, this event can be experienced directly, witnessed, or it could involve learning of someone else's experience. So someone can experience a traumatic event to themselves, they can see it happen to someone else, or they can hear that a traumatic event happened to someone close to them, like a close family member or friend, and all of these can constitute trauma. In contrast, complex trauma involves multiple events or continuous events. So this could be a child having both physical and sexual abuse, or it could be an ongoing source of trauma like neglect, which isn't really isolated to just one time. Furthermore, this complex trauma involves harm or abandonment, and it is typically interpersonal, meaning that the source of trauma occurs within a relationship. It also typically begins in childhood or adolescence. And so this is important because this is a period where people are growing and developing and learning how to relate to others and who they are. And so the occurrence of trauma during this time period can be very detrimental. And lastly, complex trauma is usually caused by caregivers, which can make it that much more impactful. To further understand the differences between trauma and complex trauma, let's look at some examples. So on the left-hand side of the slide, you can see some examples of trauma, which can include things like witnessing a murder, being in a car accident, being raped, or being part of a natural disaster. In contrast, complex trauma includes things like childhood neglect, repeated sexual and physical abuse, family substance abuse, and exposure to community violence. Now, one thing that you should notice is that the complex trauma ones pretty much all occur within the context of a relationship. In contrast, trauma can involve a relationship, or it can also be something that is not interpersonal, like being part of a natural disaster like a tsunami or an earthquake. Furthermore, again, complex trauma typically starts in childhood, making this another distinguishing point between the two types. Now, before we go further and go into some of the impacts on complex trauma, I do want to offer a brief caveat, and that is that the field of complex trauma is still an emerging field for research. And so we don't have complete agreement over the entire field of how complex trauma causes symptoms, and there's also disagreements about what diagnoses should look like for complex trauma. So as I go into some of the research on the impacts of complex trauma and how it works, please keep in mind that there will be new research developments in the future and that we're still learning things. So as you can see from this slide, there are a range of different areas that complex trauma impacts, including things like individuals' stress responses, their responses to threats and rewards, their tendency to engage in things like dissociation, which is when someone tunes out of actively experiencing something and kind of just stays in their own internal mind. And it can also impact things like people's mental health and their sense of meaning. While it can be helpful to understand all of the different areas that complex trauma can impact, it's also helpful to have a unifying theme for how complex trauma works. And Morelli and Vellotis describe the fundamental impact of complex trauma as being an inability to self-regulate. And so self-regulation means that a person can control various aspects of themselves. So when something is functioning too high, they can bring it back down, or something isn't functioning well enough, they can bring it back up to a normal level. And so for individuals who've gone through complex trauma, this can impair their ability to regulate their emotions, their physiology, their attention, their behavior, and their relationships, which are all things you will likely see in some of our campers. Aside from this pervasive inability to self-regulate, some other impacts of complex trauma include that it can contribute towards internalizing problems. And so those are bad ways of responding to stress that are internal, so things like anxiety or depression. In contrast, it can also contribute to externalizing problems, so think of behavior problems or when people act out when they're stressed. Complex trauma can also contribute to the likelihood of developing mental illness or contributing to substance abuse, and it can also increase one's risk of resorting to suicide. And it can also contribute to poorer functioning in school or in jobs or even in the legal system, contributing to more people getting arrested or being on probation. So now that we've gone over some of the impacts of complex trauma, it can be helpful to compare it to the impacts of acute or regular trauma. Now, again, as a caveat, these are generalizations and people respond to trauma differently. So it's not a guarantee that someone who goes through complex trauma is going to experience these issues, but it is more likely. And so going on to the differences, one difference between acute trauma and complex trauma is that acute trauma tends to disrupt people's sense of meaning and safety, whereas complex trauma can disrupt development as a whole. And so while both of them are bad, the complex trauma can contribute to not meeting one's milestones or learning how to build relationships, which can have a greater impact on one's life. Another difference between the impact of acute trauma and complex trauma is that in acute trauma, the symptoms tend to be pretty similar across the lifespan. So a kid who goes through one traumatic event tends to respond similarly to an adult who goes through one traumatic event, although again, there are some differences. In contrast, for complex trauma, the presentation of symptoms or how people respond tends to change from when someone is an infant to a child to an adolescent to an adult. And so this makes complex trauma harder to detect and therefore harder to treat. Another difference between acute trauma and complex trauma happens with what it causes. So acute trauma typically causes conditioned responses. So the best way to describe this is if you were in a car and you got into a car accident, you might have a sudden surge of fear because you were in danger. And your brain is really good at making connections. And so then your brain associates being afraid with being in a car. And so then the next time you're in a car, your brain might think, oh, I need to be afraid, I'm in a car. So that's kind of how conditioned responses work. In contrast, complex trauma fundamentally involves an inability to regulate. So it's not limited to just reminders of the trauma, but it's an impaired ability to regulate one's attention, one's emotions, one's behavior, etc. As I kind of hinted at, acute trauma also is typically in response to trauma reminders. So for the classic example of like PTSD in a veteran from combat, when they hear something that sounds like gunfire, it brings them back to the stressful reminder. In contrast, complex trauma responses aren't limited to just trauma reminders. And so even things that seem innocent, like transitions from activities at camp, can cause stress responses in these kids. And lastly, one of the big differences between complex trauma and acute trauma is that complex trauma incorporates a lot of the typical acute stress traumas responses, but it also includes some additional symptoms. So now that we know what complex trauma does, it can be helpful to know how it works. Now, again, there isn't complete agreement on how it works, but there are a couple of different ideas on ways that complex trauma may contribute to the impacts that we see. One of the theories has to do with the fact that healthy relationships help individuals develop their sense of identity and their self-regulation. And so the theory goes that since complex trauma disrupts healthy relationships, then this in turn disrupts one's ability to develop a sense of identity and self-regulation, hence resulting in impairments in self-regulation. Another way that complex trauma could contribute to these problems is through relationship betrayal. Since complex trauma occurs often within the context of a relationship, and this is a relationship that's supposed to be helpful and good but is actually bad and destructive, then people can internalize an idea that relationships are dangerous or bad, which can lead to disrupted, disorganized relationships in the future, because our brains are really good at making connections. And so when you learn from it early on that relationships are sometimes safe, but they're sometimes dangerous, then you take that model, and when you have a different relationship, you're constantly worried, okay, when is this going to be safe? When is this going to be dangerous? Lastly, complex trauma, as it causes trauma, triggers a stress response. And so a stress response is a normal thing, but the problem is normally stress responses are supposed to turn off. And so when you have an acute trauma, or an acute stress, like, running into a lion, the stress response helps you get ready to run away or to fight. And then once you're safe, it turns back off. But complex trauma doesn't really stop. There's not it's done, it keeps going. And so this stress response stays on, which can be negative for one's physiological development. So it can impact how the brain develops and how other parts of the body develop. So in the midst of learning all of the ways that complex trauma can negatively impact people's development and future and functioning, it can be kind of overwhelming, and it's helpful to remember that there is hope in the midst of this. And so one of the main things to keep in mind is that people are incredibly resilient. And so people can go through complex trauma and not have pervasive, all-encompassing negative outcomes. Another source of hope is that strengths can really help prevent people from developing bad responses to complex trauma. So having a helpful family relationship or having positive non-family relationships can help increase people's resiliency so that they don't develop negative stress responses. Other things like having a spiritual sense of meaning or developing certain coping skills can also contribute to people responding better to complex trauma. And lastly, there are effective treatments for both trauma and complex trauma, such as stage-based treatments. So even if people are having a hard time and are having negative impacts in many areas of their lives, they're not entirely without hope. So now that we've gone over that there is hope, let's talk about how we can offer these campers hope. One of the ways we can do that is through trust-based relational interventions. Now, if you read your handbook already like you were supposed to, this is probably going to sound familiar because TBRI is one of the programs that we include in Royal Family Kids Camp. And TBRI is a relationship model for helping at-risk kids. And the fundamental idea behind it is since these kids have had trauma in relationships, then they need healthy relationships in order to repair the damage that was caused. Now, the fun thing about TBRI was that it was developed at Camp Hope, which is a summer camp for kids in the foster care system. So it's really applicable to our work today with Royal Family Kids Camp. TBRI uses research-based practices to help kids with trauma, and it's been used by diverse organizations and groups all over the world, and it has been found to improve traumatized kids' outcomes. And so that's a really exciting thing. Now, there are three pillars of TBRI, and they go in order. And the first pillar is the empowerment pillar, which includes meeting kids' physical needs like safety, food, and things like that. The second pillar is the connection pillar, which involves meeting kids' relationship needs. And the third pillar is the correction pillar, or meeting kids' behavioral needs. And the fundamental principle of TBRI is that you do need to go in order. So we can't correct kids' behaviors until we've established a relationship. And we can't really establish a relationship until kids feel safe and feel like their needs are being met. Now, the interesting thing is the TBRI principles actually sort of match the general trauma treatment model proposed by Herman. Herman's model for treating trauma means that says that you should first establish safety for the person who's been traumatized, and then help them retell the story of their trauma, and then lastly reconnect with others. Now, while not exactly equivalent, both models emphasize the fundamental importance of meeting people's needs or establishing safety first in order to help resolve trauma. Now, you may be wondering why we're using relationships to help address trauma. And one of the reasons for that is that the attachment system is malleable. So the attachment system is people's internal understanding of how relationships work. So when kids are at a young age and they start developing relationships, their brain makes a model of, oh, this is how a relationship is supposed to go. The problem is that in complex trauma, these relationships are negative, meaning that these kids have a bad model of how relationships are supposed to work. And so if we can offer positive, healthy relationships, then we can help them change that internal model and include a healthy model of relationships. Another reason why we want to be developing positive relationships with these kids is that positive relationships can have a great protective role on improving kids' outcomes after complex trauma. In Kisiel et al.'s research on kids in the foster care system who had complex trauma, they found that kids who had positive relationships had better outcomes than kids that didn't, showing how important these positive relationships can be. So now that we've gone over some of the basics of TBRI, let's look at some specific skills that we can put into practice with our campers. So under the pillar of empowerment, one of the ways that we can help build relationships with these kids is through meeting their physical needs. So one of these is meeting their need for safety, which includes helping kids be aware of transitions and routines. Kids do really well when they have structure, and so when we're clear about establishing a routine and giving warnings about transitions, then kids can understand, okay, I know what's going to happen next, which can help them improve their ability to regulate. So an example of this would be giving pretty extensive warnings about transitions. Anyone who's been at camp before will know that transitions are a difficulty. And so it can be helpful to let kids know, hey, lunch is going to be done in 10 minutes and 5 minutes and 2 minutes and 1 minute to give kids the time to regulate and get ready for the next activity. Another way that we can help meet kids' empowerment needs is through meeting their sensory needs. So providing safe touch like side hugs and sensory activities like fidgets to help engage those physical needs. And another physical need is food. And so we provide scheduled snacks throughout the day so that way kids' physical needs are met so that way they can then engage in building relationships. The next TBRI principle is connecting, and there are a bunch of different ways that we can help foster relationships with the kids. Listening is listed last, but I think I probably should have put it first. And listening is fundamentally important for helping these kids feel heard and understand that they are valuable and worth listening to. And one of the ways we can also use listening is to help when the kids are having a difficulty expressing themselves. Oftentimes, if our kids are getting overwhelmed, they have difficulty expressing it with their words. So they might be throwing a fit or getting aggressive. And one of the ways that we can help build a relationship while also reducing behavior problems is by saying things like, hey, can you say that with your words? Another way that we can help build relationships is through attunement. And that's basically a fancy word for kind of meeting a child where they're at. And so when we're talking with kids, we can help get down at their level and kind of be like, hey, how are you doing today? What's going on? And lastly, a way to connect is playful engagement. Now, obviously, we're going to be doing a lot of playing and having fun at camp, but especially when kids are having a hard time, we can we can interact with them in a playful way to show that we still care about them and that the issue isn't as serious as they're making it out to be. So, for example, when the kids are kind of being sassy or demanding, we can say back to them like, "Hey, are you asking or telling?" And that gives them a chance to kind of reset and respond in a different way while still being in the context of a positive relationship. And so now we come to our last TBRI principle of correcting. Now, the goal of TBRI and Royal Family Kids Camp and trauma research treatment, as a whole, is to build relationships. But in the process of camp, we will have some instances where we do need to correct some behavior problems. And so one of the ways that we can do that in the context of a relationship is following the different levels of correcting. So the first level is playful. You'll see again the asking or telling strategy, which is a way to engage with kids in a playful manner while encouraging them to change their behavior. If kids aren't really receptive to that, then we can move on to the structured level of correction, which can include things like offering choices, which is always a good option, and offering negotiation. And this helps meet kids' needs for autonomy and teaches them that they can be an independent person. If that one doesn't work, then we can go on to the calming level of correction, which includes a time in where kids have a chance to calm down and get some self-regulation. And it can also be through providing a space where kids can self-regulate, where they have access to sensory things like that. And lastly, if something is really getting out of hand, we can resort to a protective thing, although that is where we would be contacting the care team, as you'll learn about as we go further on in our training. So thank you everyone for listening. I hope that this was a good overview on what complex trauma is, and I hope that as you're interacting with the kids, you'll understand a little bit more about what they've gone through and how that impacts their ability to make relationships.